Hi everybody, thank you so much for watching. If you don't know who I am, my name is Claire Carmichael and I'm studying nursing, adult nursing, and I'm in the second year. So welcome to my vlog, and today I'm going to be talking about the top most common questions that I get asked all about nursing. If you're going into nursing, if you're thinking about a career in nursing, these are the things that you're going to want to know. So the top thing that most people want to know, that I can gather from social media, from people asking me, is all about placements and how the hours are, what the shifts are like, how is it for some people, what is placement really like? So the hours and shifts of placement depends on what trust you go to, what university you're with. It depends on the area you're working as well. But for the majority of people, if you're on the ward, you will be doing 3 long days, 12.5-hour shifts, and then you get 4 days off, which is amazing. So yeah, so like I said, it just depends on what trust you're working at. Some people will do different shifts, some people will just do days, some people will do night shifts. Please don't think you're going to get all this time off and you're not going to have to work a bank holiday or a night shift, because whatever your mentor works, you have to work it. You will be expected to do night shifts, and it's part of, I'm sure, the NMC guidance as well, that you experience the whole 24-hour system of care and what it's really like. So you need to do at least one night shift to cover yourself. In total, the total amount of hours for my university at Birmingham City University is 2,300 hours of placement, so that's spread across the 3 years. Like I said, it depends on what ward and things that you work on. So on the wards it's usually 3 long days and 4 days off, but then every 4th week you will have to do a 4th long day just to make up the hours, because the hours they don't kind of add up, if that makes sense. But that's a whole nother thing completely. So you are going to be expected to work the whole 24-hour care system, from 7 o'clock in the morning until 7:30 at night. That's your shift. Or some people do, I think it's like 8 till 9. But either way, it's a long day. If you're doing a night shift, it's usually 7 p.m. until 7:30 a.m. in the morning, and nights are hard. I'm not going to lie to you here. I personally struggle with nights. I'm a sleeper. I love my sleep. I'm usually asleep by 10 o'clock at night. Proper boring. So when I went on to do my night shifts, it killed me. I did 3 night shifts in a row and it made me sick. My sleep pattern was all out. I couldn't sleep in the day. Your eating pattern is all out. I'm finding them having my dinner or breakfast, I don't know what it is, at 3 a.m. in the morning. That's weird to me. So that's the cons of night shifts. But the pros of night shifts, it's a lot quieter in the night, depending what area you work. The ward I worked on, it was really quiet at night. You didn't have much to do. You had your observations and things to do. You had to empty catheters, to take people to the toilet, and to be honest, I didn't do much on my night shift. But as a student, that's good, because you can sort of use the hours to do a little bit of revision, to fill out your placement books. For Birmingham City University, we have a placement document, so we have to fill that out as we go throughout our placement. So that's a really good chance to get some of that done as well. And nights are a great chance as well to sit down with your mentor and go through any skills or anything you need improving on. It's a good chance to get a little bit of training in as well with your mentor. So I think that's a really good plus from the night side of things. Obviously, if a patient needs you, that patient comes first over anything else, because it is a real life situation. It's the real life. There's people's lives that depend on you. So that patient's going to come first before anything. And if you have a community placement, usually it's going to be, it depends where your community lies, but from what I've heard, if you've got something like a GP practice setting, you're going to be working Monday to Friday, standard hours, which is nice, I think. I think there's pros and cons to all of these hours. Monday to Friday, 9 till 5 or 8 till 7 a couple of days, I think, and then you do 3 short days. I think working 5 days is nice because it's more spread out. You get a little bit more time off in the evenings to sit and have dinner, and you get your weekends off, which is amazing. But then again, when you're on the wards and you're working 3 days and then you've got 4 days off, I think that's really nice, because it's 4 days, you've got more time off to revise, to do your studying, to fill out your placement books. Got loads of time to do things. So no matter what hours you're doing at placement, just make the most of it. Just, you know, if you've got any appointments and things like that, do it on your days off, work around it. Your mentors are going to be so lenient as well. If you've got a wedding to go to or a birthday coming up, just speak to your mentor, be honest, and they will honour some time off for you and work around that. You know, they're not dragons. So I think just make the most of it and don't be afraid. Another question about placement is, how are placements really? Are they hard? Are they easy? I'm scared, I'm nervous. Don't worry, guys. Okay, so me personally, I'm not a fan of the wards. I've said this before, I'm not a ward nurse. Do I make the most of my placement? Yes, absolutely. I go out there and no one would ever tell that I didn't really like work on the wards. You know, I'm enthusiastic, I put everything into it, I'm so keen to learn everything, and I learn from every experience. So if you don't like your placement, don't worry, you know, you're going to learn something from that placement either way. You're going to learn that you don't like that particular ward, what they do, you don't like that particular nurse's attitude, for example, but that's fine, because that's going to mould you into the nurse that you actually want to be in the future. And the wards, I'm not going to lie, the wards, they aren't easy. You're not going to have a lovely, beautiful, peaceful time on a ward. It is manic. You've got patients' lives at risk. You've got to be so careful what you do, what you can't do, what you can do as a student nurse. So as a student nurse, you'll be told by your university what you can and cannot do whilst out on placement. For example, I'm Birmingham City University. I know I'm never allowed to give an IV. Never, ever, ever. Not even third year, all across the board, first, second, third year, we are not allowed to give IVs at all. We're not allowed to take blood either. You know, anything to do with veins, going into the vein, no, please don't do it. And I know that, and I will never, if anyone asks me to do that whilst on placement, because sometimes your mentor might have a different view. They might think that you're allowed to do it, and they might say, oh, come on, yeah, let's do this IV, this will be really good, it'll get your skills up, and they might have a different attitude, and you have to say, oh, I'm really sorry, you know, actually as a student I'm not allowed to do that. It's not until I'm qualified and actually I do the right training for it that I can do those. But I'll happily watch you do it, no problem watching and seeing what they do and how they do it. As a student, just make sure that you know what you can and can't do by whatever university you're at, because you don't want to go out and do something on placement and then get into trouble for it or be reported for it. It's not worth it. It's not worth your pin before you've even started. Just double check. And I'm just going to talk a little bit about, actually, while it's in my head, just the whole day, a day shift of the ward. So basically you go in 7 AM, you have your handover, you've got your team, you're getting debriefed on each patient, then you start your shift. So I went round and I did all the obs for my mentor. So that's the blood pressure, temperature, pulse rate, respiratory rate, all of that, because that's going to be your baseline for that patient. If anything's going to go wrong with that patient in the day, you're going to get the early warning signs usually with the observations. Something will be off. Then after I did my observations, I went round and I went with the healthcare assistant, and we got everybody that needed assistance washed and dressed. Anybody that didn't need assistance, we just went in and offered the assistance anyway, and gave them some bowls of water and soaps and things, depending if they wanted to shower or if they just wanted a wash. And we'd just leave them to it if they could do it themselves. If they couldn't do it themselves, we'd obviously help them. You know, don't think being a nurse it's all about giving medications, giving injections, doing wound dressings. You are going to have to get down and dirty as a nurse, as a student nurse as well, especially because you're going to have to learn all of the basics from scratch, whether you've done it before, whether you've been doing it for 10 years, 20 years, you're going to have to do it from scratch as a student nurse. So you'll be put with that HCA, you'll learn the whole ward routine, you'll learn every single patient, what they like, what they don't like, their preferences with washing, and you're going to help them get washed. You're going to have to wash areas that you don't particularly want to. That patient certainly doesn't want you to wash their particular areas, but if for whatever reason they might not be able to physically do it, and you're going to have to do that for somebody. And you know, you're just gonna have to throw yourself in there and help, but be respectful. Respect that person's dignity when you're doing the personal care, and just keep them as covered as much as possible. You know, you don't want to embarrass that patient. Just make it natural for them. Just be yourself, talk to the patient, make them feel comfortable and make them trust you. You know, that's your time to build a relationship with that patient. That's your time to notice any skin changes with that patient. You know, if they've got any pressure areas, they've got any cuts or wounds or anything, you're going to notice that from washing that patient and helping that patient dress. And obviously if they can do it themselves, you encouraging that patient to do things independently, because it is all about promoting independence as well. But I'm just saying, if that the patient physically can't do it, you're there to help. Don't think you're too posh to wash. And actually, speaking about posh to wash, Tony is another student. She does blogs as well, and she's absolutely fantastic. She did a blog about being too posh to wash, so I'm going to add the link below for you to go and have a look at that, because it's a really good blog to look at. So then after all your personal care is done, all your patients are ready, then you will go round checking all of the charts at the end of the patient's beds, you know, the fluid charts, the skin charts, the risk assessments. You're going to be doing all the documentation then, making sure, encouraging patients to eat and drink is probably one of the most important, because we kind of forget that, I think, as a nurse. Sometimes you've got so many things, you think, actually, has that patient had a drink today? They've got a jug of water, but actually it's still full. You need to be encouraging that patient to drink, keep hydrated and get well again. Then you're going to be helping dish out the lunches, and you're going to be helping people to eat if they need assistance, if they're immobile for whatever reason, they can't use their hands. You're going to have to help feeding that patient, so that'll be a lunchtime thing. And then again, once lunchtime's over, you're going to have to document in the food charts, if they've got a food chart, if they're malnourished, if there's any risks there, you're going to have to fill that out and make sure that that's complete. And as well, you're going to have to answer call bells. That call bell will be going, there'll be different patients wanting different things from you. There was always that one patient that just presses. Doesn't matter what it is, they'll be pressing for you all day, waiting. And you will go into that patient with a positive, beautiful face, the nurse face, that poker face that we all have. Hello patient, how are you? I'm sorry that you're ringing your bell, what can I help you with? And then they'll probably say, have I pressed my bell? Don't remember pressing my bell. Oh well, I'll call you again if I need you. Okay, don't worry about that, you know, press as many times as you want, I'm always here if you need me. And then you'll have patients that are really poorly, they're vomiting, they've got massive amounts of diarrhea that you are going to have to clean up. So please be prepared for that. Don't think you're not going to get out. Don't think you're going to get out of doing that, because you're going to have to. It's what we're here for, to help patients and to care for them, good and bad parts. And with all this going on, you'll have a patient that needs a catheter inserting, you'll need a patient that needs a catheter removing, you'll have wound dressings to do, you'll have body checks to do to make sure that everyone's skin's intact. You will have clips to remove if they've got a surgical wound with the clips or sutures, you know, you'll be asked to help with that if you're allowed to and have been trained to, of course. Also, you'll help with NG feeds. You'll help with the medication round with your mentor. You will be answering the phone as well. Don't think you're going to get out of answering the phone. You've got to pick that phone up on the ward if it's ringing, nobody else is answering there, no one else is answering. You're standing there, you're like, the phone's ringing, no one's about. So just leave it. Should I answer it? Oh my god, what do I say? That is generally probably what I thought to start with, but I thought, you know what, I'm going to do it. So I was like, hello, student nurse Claire Carmichael, ward 2. And they always go, hello student nurse. They're always very nice when you answer, so don't worry about it. Just have the courage to pick up the phone if it's ringing, because if that's a relative and they want to know about the patient, or if it's something, even if it's something very important, it might be, I don't know, something about medications for a patient from another ward, or you need to pick up the phone. You be that person to pick up the phone and help somebody. Okay, so I've spoken so much about placements now. I probably could have done a whole vlog just on placements alone. So I'm going to go into mentors. A lot of people have been asking, am I going to like my mentor? What if I don't like my mentor? What if we have personality issues? You're not going to get on with everybody. Don't worry guys, you're worrying too much. From my experience, mentors have been very knowledgeable. They've been very experienced nurses. They're just very busy, you know, with the staff shortages on the ward. They're going to be very busy, they've got patients to look after, they've also got you to train, as well as all of the things that they've got to do for that day. And they're going to be a little bit stressed sometimes, they might even forget to say please and thank you sometimes, but just please don't take it to heart, please, because the mentors, they're doing the best they can. Some mentors will be amazing, some mentors will be like, oh yeah, come on, I'll get you to do this, I'll show you how to do that. This is amazing, I love students, please follow me all the time. And other mentors will be like, just go with the healthcare assistant, work with them, I'll see you later. Some mentors have done that and they will do that. And please don't be offended. Some mentors, especially first thing in the morning, they've got the whole drug round to do first thing in the morning, and that's the busiest drug round. So they like to concentrate on the drugs, see that the patients are okay, and then do the training things after. So please don't be offended. They're just trying to do their best, so please don't take it to heart. And if you don't get on, genuinely don't get on with your mentor, you've got a personality clash, you're having real problems with your mentor, you're not learning anything, just speak to somebody. You've got your ward manager you could speak to. I mean, you could speak to your mentor if you feel comfortable in saying, as long as you're professional about it, and go to your mentor. You could say something like, I don't think that I'm getting enough skills, you know, you've got a book of things that you need to get signed off and you're not getting that signed off. Just please, can you just go through this with me? Can you do that with me when we've got a bit of spare time in the afternoons when it's a bit quieter maybe? And I'm sure they'll be fine. They've probably just got so busy, they've kind of forgot a little bit about what they're actually doing with you. So please don't be disheartened. And you've got your ward manager that you can speak to if you can't speak to your mentor. You've got your practice placement manager, which will be a nurse that works between the university and the hospital that you're working at. So they will be dedicated to you, as well as other students, of course. And yes, so you can go to them. You'll usually have their email and phone number, so you can ring them if you've got any problems whilst out on placement. You can speak to your university placement team as well. They are amazing. I know at Birmingham City University they're just incredible. They're always there if you need them. Just give them a ring, email them, and they will sort it out. And I've heard of people, not in my year but from previous years of nursing students, they've had such big problems on their ward that they haven't liked it that much. Their mentors they haven't got on with their mentor, and they've actually been taken out of that placement and put on a new placement, and no student will ever be put on that ward again if it's that bad. So please, you do have to speak up if it's really that bad, and don't be afraid to speak up and say something if you're not learning, you know, just say something. You have to also remember that you're there to learn, you're there to train, so make the most of every second. And on the flip side of the mentors, as students, some mentors don't want students because some students have given us student nurses a bad name from bad practice, from comments, from being negative, and that's horrible to see. And I heard apparently a student said, I'm not here to wash and dress patients, I'm not here as a HCA, I'm here to be a nurse and do nurse skills. No, I'm sorry, nurse. It makes me so angry. This is the only time you'll see me angry, by the way, everybody. I'm usually a positive, lovely person. But no, that's so wrong. And if you've got that attitude, maybe you should really think about what you're doing, and you need to reevaluate the way you are and how you're coming across, because I'm sorry, but we do it all. Nurses do it all. I saw my ward manager on my last placement, who's top of the ward. She's there, she's got all of her things that she's got to do. They were short-staffed on the floor. She came out and she washed patients. She rolled up her sleeves and got in there. You know, don't think that you're too posh to wash. This is the too posh to wash thing again, isn't it? Students making those comments are giving us a bad name when we are good students. I know I'm a good student. I love to learn. I'm enthusiastic. I get in there. I do everything that's asked of me. So just be a good student. Please don't give us a bad name. Just go out there, enjoy it. Even if you hate every second of it, put that smile on, put your nurse face on, and just enjoy it. But then thinking of that as well, if you feel like you're being fobbed off quite a lot with other people and this person and that person, that's when you do say to your mentor, I don't think I've got these skills in yet, do you think we could just work around it and find some time to do that? There's ways of saying things, there's ways of doing things, and there's ways of approaching things. So please bring that passion in your heart, be positive, love life, give us a great name. Can I work while studying nursing? Yeah, you can, of course you can. But please just check your universities or your trust's legal contracting working hours, because I think it's something like you can only do 48 hours a week. That's the UK legal requirement, and you'd have to sign a separate contract to do over 48 hours a week. So please look into that if you're going to do bank shifts. I personally, I don't work through placement because I just haven't got time and I don't want to break any laws or rules or regulations. So I personally don't work placements, I don't do any bank shifts extra. What I do though is I work all of my annual leave, which some people might think, oh, no way I'm gonna have my annual leave as working. But do you know what, if you want to get through it and you want your bills paid, that's what you've got to do. And it's only for 3 years, we're in this for 3 years, so it's not like it's going to be a lifetime thing. And I save all my money up, so when I come to my placement it covers me, so it's good to balance it out. So please just go and have a look at some bank shifts on the NHS website, job site. There's a website called NHSP, National Health Service Professionals, which is dedicated to bank shifts for the NHS if you want to do that. And yeah, but just always make sure about your university's requirements and things, because I don't want to get into trouble. And to be honest, I think we've got a lot more time off than I ever imagined. I thought I was going to be in university every single day, all day, every day. My placements were going to be horrendous. But do you know what? It's great, guys. It's not as bad as you think. So don't be disheartened and don't be thinking, oh my God, I'm not going to be able to do shifts and things like I was thinking like before I started. Because you can do it. It's so easy. I mean, for people that have got children and things, it might be a little bit more difficult because of childcare. So if you haven't got children, this is my advice. Just work your annual leave and things and you're going to be fine. How am I going to balance and organise everything? Well, to be honest, I can't tell you how to balance and organise your life. You're an adult, you're independent, this is an adult course. You're going to have to organise yourself, guys. You're going to have to figure out what comes first with exams, what comes first with assignments, prioritise them all, study for the one that comes first, obviously. As soon as an assignment is launched, get on it, get your draft done and dusted, study, revise, just fit it all in around your life, your course, and just, I think you need to just find your feet to begin with. If you're not nursing yet and you're just going into it, just take the first couple of months to just find your feet and organise yourself. You're not going to be at uni 24/7 doing lectures. Find time in between lectures. Sometimes you're going to have a 2-hour gap. Do your revision, do your assignment, make the most of every second at university to do that time. If you've got a day off, just do it. You know, be really, what's the word I'm looking for? Be disciplined. That's the word I was looking for. Oh my God. You've got to discipline yourself. Just, you know your limits, you know what you can do, you know what you can't do. Only you can organise yourself. Is the course tough? If you knuckle down, you do your revision, anything's easy. And exams are only easy if you know the answers, and you're going to do that by revising. It's not a walk in the park. I'm not going to lie and say, actually no, it's easy, it's great. Do you know what? I find it easy because I revise. I work so hard. I dedicate myself to university and nursing. That is my priority, that is my love, and that's what I do. And it's not hard. It's not hard, guys, if you revise and your head's in that good space. Make it easier for yourself. Revise, get on top of things, be organised, and there's plenty of support available, which is another question that's often asked. Is there enough support? Yes, I'm not an academic person. I've said this before, but you've got a personal development department team that are going there. You can have one-to-one tuitions with your tutors, the personal department team, lecturers. You know, there's so much help out there. You need to ask for it. And if you have any sort of mental health or disabilities, anything like that, they're there for you. They're there to help you and support you. They don't want to see you fail. They don't want to see you kicked off the course. You know, they want to see you be the best you can and do the best you can. So they're there to help support you through this process. But at the same time, you are an adult, you are independent, so you do need to do the work yourself as well as getting that support and help. As well as saying that, if you do have any mental health needs, any disabilities, you know, they will give you extra time, extra allowance, so there is the support there for you. If you've got dyslexia, there'll be support there for you. So always ask, always make it known, don't try and hide it. Just please get the support, and someone will be out there to help you, as well as your friends, as well as other students. You can have the lecturers and the whole team that are going to support you through this. And if you're not too sure about what universities do what things, just ask, ring them and just ask before you start. It's the only way you're going to find out. So don't worry, you know, it doesn't matter what walk of life you come from, where you've been before. Nursing is amazing. You're going to love it, you're going to enjoy it. And I hope that throughout this vlog that I've answered as many questions as I can, without making this too long a vlog, because I wouldn't want to sit there watching somebody talk for 20-30 minutes. It's boring. But I'm hoping I've answered some questions. I'm hoping I'm giving you some good insight to nursing. And yeah, good luck. Here's to the future of nurses.